Let's continue our discussion of diagnosis according to pathogenic Qi with exit, heat, and fire. Excess heat and fire has its etiology in excess heat can arise in several ways. It will mainly result from dietary and emotional na po. So let's take a look at the etiology of excess heat and fire. Excess heat can arise in several ways. It will mainly result from dietary and emotional influences. Hot food and beverages such as hot spices, lamb, alcohol, fried food, and so on will create heat. This will generate heat in the liver, stomach, and intestines in particular. Prolonged emotional imbalances such as stress, frustration, and anger will typically generate heat in the heart and liver. Tobacco smoking creates heat in the lung. Exogenous pathogenic heat can directly invade the body. The invasion can be located in the exterior, but there can also be direct invasions of exogenous heat into the interior. Yin pathogens can transform and turn into heat. Invasions of cold can transform into interior heat, while dampness can transform and turn into damp heat. The symptoms and signs are as follows. Thirst, an aversion to heat, unless the pathogenic heat is in the wage aspect, in which case there will be an aversion to cold. The skin may feel warm on palpation, the face can be red, there will be secretions and exudations can change color and become yellowish or greenish. Secretions and exudations become thicker and more sticky. Secretions and exudations can become odorous or taste strongly. There is pain that is throbbing, stinging, or burning, excessive sweating or no sweating, constipation, red tongue, and a rapid pulse. The symptoms and signs of specific fire and heat patterns. In heat in the exterior, there is mild or high fever, thirst, red eyes, red and sore throat, yellowish secretions from the nose, cough, possibly with yellowish sputum, an aversion to cold, there is shivering, a superficial and rapid pulse, possibly a red tip to the tongue or a yellowish coating on the tongue. If there is stomach fire, there will be thirst, excessive appetite, stinging or burning sensations in the stomach, indigestion, bad breath, bleeding gums, mouth ulcers, constipation, red tongue with dry yellow coating, and a rapid and full pulse, especially on the right guan position. If there is liver fire, there will be thirst, irritability, anger, headache, a bitter taste, red eyes, dizziness, red sides of the tongue, dry yellow coating, fast and wiry pulse, especially in the left guan position. If there is heart fire, there will be mental agitation, restlessness, mania, insomnia, palpitations, ulcers on the tongue, thirst, red tongue tip, a rapid pulse, especially in the left tune position. If there is lung fire, there will be cough, thick, sticky, and yellowish sputum that possibly contains blood. There will be thirst, redness in the front third of the tongue, rapid and full slippery pulse, especially in the right tune position. If there is heat in the intestines, there will be constipation, pain or discomfort in the abdomen, The abdomen is distended and tense. There will be dry yellow coating on the tongue, a rapid and full pulse, especially on the trip position. If there is heat in the urinary bladder, there will be dark yellowish urine that is odorous. The urine may contain blood. There will be frequent scanty and burning urination, yellowish coating on the root of the tongue with raised red papillae, rapid and full pulse, especially in the left chirp position. If there is toxic fire, there will be inflammation with pus or greenish secretions, erosion of the skin or mucous membrane, a swelling in the area that will be extremely red in color and feel warm on palpation. The area will be painful. There will be a red tongue with a dry yellowish coating and a rapid and wiry pulse. For the treatment principle, we expel or drain heat. For the acupuncture points, we can choose from extra point of the head and neck 6, urgent, do 14, and LI 11. If there is heat in the exterior, add do 16, LI 4, Sanjiao 5, lung 7, lung 11, and gallbladder 20. If there is heat in the lung, can add lung 1, lung 5, lung 10, and urinary bladder 13. If there is heat in the heart, you can add heart 8, pericardium 5, pericardium 7, pericardium 8, bladder 14, bladder 15, and ren 15. If there is heat in the liver, can add liver 2, liver 14, and bladder 18. If there is heat in the stomach, we can add stomach 43, stomach 44, stomach 45, ren 12, bladder 20, and ren 13. If there is heat in the intestines, we can add stomach 25, stomach 37, stomach 39, and stomach 44. If there is heat in the urinary bladder, can add bladder 28, bladder 32, and ren 3. Can use the draining technique, and if there is extreme heat, do 14 and urgent can be bled. For further explanations, extra point of the head and neck number 6, LI 11, and do 14, drain and expel heat. Do 16, lung 7, lung 4, Sanjiao 5, and GB 20, expel heat from the exterior. Lung 1, lung 5, lung 10, and lung 11, and bladder 13, drain heat from the lung. Heart 8, pericardium 5, pericardium 7, pericardium 8, bladder 14, bladder 15, and ren 15, drain heat from the heart. Liver 2, liver 14, and bladder 18, drain heat from the liver. Stomach 43, stomach 44, stomach 45, bladder 21, and ren 12, drain heat from the stomach. Stomach 25, stomach 37, stomach 39, and stomach 44, drain heat from the intestines. Bladder 28, bladder 32, ren 3, drain heat from the urinary bladder. A person with excess heat must avoid food and drinks that have a hot energy. They must also avoid stress. When there is heat in the exterior, it is recommended to drink mint, chrysanthemum, elderflower, or chamomile tea. Heat and fire can be caused by the following pattern of imbalance: invasion of pathogenic qi and qi stagnation. And in turn, this can result to yin deficiency, phlegm, wind, and deficiency heat or blood heat. Thank you for your attention.